Welcome to another deep dive with us. This time we'll be exploring a topic that's pretty central to nursing, and that's spirituality.
Definitely central, and I know a lot of nursing students want to get this right.
That's why we've got this awesome nursing textbook chapter, some critical thinking guides, and even some case studies to really see how it all plays out.
Awesome.
Our mission today is to help you guys not only grasp the core concepts, but actually see how spirituality shows up in real-world nursing. And who knows, maybe even spark some reflection on your own beliefs as future nurses. What do you think?
Sounds good to me.
So to kick things off, let's just jump right into one of those case studies. We read about Choi Min Lai, who's refusing foot surgery for his son. The reason? He believes that the deformity signifies, get this, spiritual favor in their Hmong culture.
Wow, that's a powerful example of how cultural and spiritual beliefs can sometimes clash with what we might typically consider the best medical course of action.
Absolutely. It really highlights that potential for conflict. And that's exactly why understanding spirituality is so crucial for nurses.
It's not just some abstract concept, right?
It's about real people grappling with really complex situations.
And it underscores the need for us as nurses to be sensitive and to communicate openly with our patients. How can we bridge that gap between, medical perspectives and the patient's own spiritual worldview?
That's what we're going to unpack today.
Yeah.
So let's start with some kind of foundational concepts. We often hear terms like spirituality, faith, and hope, kind of used interchangeably. But are they really the same thing?
Not quite. I mean, they are interconnected, but there are subtle but important distinctions. Spirituality at its core is really about a person's relationship with something bigger than themselves. A higher power, a sense of meaning, a purpose, even a connection to nature.
It's about what gives their life meaning, what transcends the material world.
Exactly.
So where does faith fit in?
So faith kind of builds upon that connection. It's the confident belief in something, even without concrete proof. Think about a patient who firmly believes that prayer will heal them, even when facing a really challenging diagnosis. That unwavering faith can have such a huge impact on their outlook, their coping, even their adherence to treatment.
It's not just about us agreeing with their beliefs or not, right? It's about understanding how those beliefs shape their entire experience of illness and healing.
You got it. And it's a powerful reminder for us as nurses to approach each patient's beliefs with respect and with an open mind. We're trying to understand their perspective, not impose our own.
That makes me think of hope. We discussed that too in the material. Seems like a pretty straightforward concept, but is there more to it than meets the eye?
Hope is a lot more than just positive thinking. It's that driving force that lets people envision a future even when things are tough, even with suffering and uncertainty. It's what motivates them to keep fighting, to persevere, to find meaning in the face of adversity. And for us as nurses, understanding how to cultivate realistic hope in our patients, that's incredibly powerful.
So it's not about us, like sugarcoating the situation or giving false promises. It's about helping patients find that strength and resilience to navigate whatever they're going through.
You said it. And sometimes that means acknowledging those difficult realities while still encouraging them to find meaning and purpose. That's where our role, our compassionate caregiving, really becomes so vital.
It strikes me that all of this hinges on human connection. Feeling loved, feeling supported. We can't overlook the importance of love and spiritual well-being.
Absolutely. Love is fundamental to human thriving. It's about genuine connection, belonging, acceptance, knowing we're not alone in our struggles.
And, on the flip side, feeling isolated and alone, that can be so detrimental, especially when someone's already facing illness or emotional distress.
It's true. Loneliness is its own form of suffering. It affects both physical and mental health. And as nurses, we're in this unique position to be that source of compassion, that connection for our patients, helping them feel seen, heard, valued.
So we've talked about these positive aspects of spirituality, but the material also delves into maybe a darker side suffering. What's important for us to understand about that concept?
Suffering is just part of life, part of the human experience, and it's often magnified, during illness. But, and this is key, suffering is deeply personal. It's not just about physical pain. It's emotional, social, spiritual.
What might seem like a minor inconvenience to one person could be a source of huge distress for someone else.
Absolutely. And that's why it's so important that we, as nurses, approach each patient's experience of suffering with empathy and understanding. Recognizing their pain is real and valid, no matter how it looks.
So we've explored these core concepts: spirituality, faith, hope, love, and suffering. Now, how do these ideas actually play out in the practical world of healthcare? How does spirituality influence the care we provide?
Well, that's where things get interesting. One way it plays out is through religion. We read about Jehovah's Witnesses and their refusal of blood transfusions even in life or death situations. This decision comes from deep religious convictions, and it really shows how medical necessity and spiritual beliefs can sometimes be at odds.
It's a stark reminder that we can't just dismiss a patient's beliefs because they don't align with our own understanding of medicine.
Exactly. And it reinforces the need for cultural sensitivity, for dialogue. It's about understanding the why behind their choices and finding ways to care for them that respect their autonomy and their spiritual integrity.
So navigating these situations requires a real balance, respecting the patient's beliefs while ensuring their safety.
It really does, and that can sometimes mean having some tough conversations, advocating for the patient's needs, even seeking guidance from, ethical experts or spiritual advisors in their faith community.
This brings us to another distinction: life-affirming versus life-denying religious influences. Can you expand on that a bit more?
Of course. Not all spiritual or religious beliefs are about promoting well-being. Some are incredibly life-affirming, offering strength, hope, purpose, even in the face of, really tough situations. These beliefs often encourage seeking medical care. They see it as cooperating with a higher power in the healing process.
So those beliefs can actually complement medical intervention.
Absolutely. But on the other hand, some beliefs can be what we call life-denying. They can lead to guilt, shame, unworthiness. They might influence people to refuse treatment or to do things that could harm their health.
Those situations seem like they'd require an even greater degree of sensitivity from nurses.
They really do. It's not about judging or changing their beliefs. It's about providing care within the context of their worldview, supporting their overall well-being, even when their choices might not make sense to us.
It seems like there's so much for nurses to consider when it comes to spirituality. Are there any specific factors that influence a person's spirituality that we should keep in mind as we provide care?
Oh, absolutely. One of the biggest is developmental stage. As we grow, our understanding of spirituality changes. Children, for example, see things like faith and hope very differently than adults.
So we can't assume that just because a child can't articulate their spiritual needs the same way an adult does, that they don't have them.
Exactly. And we have to be sensitive to how they express those needs. And then there's family. The things parents and caregivers model, those have a big impact on how children develop their own sense of spirituality.
It's less about what they're told and more about what they see and experience.
Precisely. Actions speak louder than words when it comes to shaping those beliefs.
Can't forget the impact of ethnic background and cultural traditions either. Different cultures have completely different ways of approaching spirituality.
Right. Some cultures are very open about it. Others are more private. As nurses, we need to be aware of those nuances and not make assumptions about someone's beliefs based on their background.
And of course, formal religion plays a role. Different religions have different beliefs and practices that shape people's approach to spirituality.
Exactly. Some religions are all about rituals and traditions. Others focus on inner peace and meditation. Still others see service to others as the central part of their faith. It's about recognizing that diversity and approaching each patient's religious beliefs with respect and with a willingness to learn.
It's so fascinating how all these factors, development, family, culture, religion, all work together to shape a person's spirituality.
Yeah.
And we can't overlook those major life events, both good and bad.
Yeah. Big life events like births, deaths, marriages, serious illness, those things can really shake up our beliefs. They can make us question our faith, search for deeper meaning, or find new strength.
Spirituality isn't static. It keeps evolving throughout life.
Exactly. And for us as nurses, that means knowing that our patients' spiritual needs might change over time, especially when they're dealing with illness and recovery.
This brings up a big question. How do we, as nurses, actually assess a patient's spiritual needs? It's such a personal, sensitive area. Where do we even begin?
It's really where the art of nursing comes in. Being attuned to our patients, not just their physical symptoms, but also their emotional and spiritual cues. It begins with making them feel safe to share.
How do we create that safe space? What can we actually do?
One way is to just ask open-ended questions that let them share their beliefs and their concerns. We could ask, what gives your life meaning? Or what brings you comfort during difficult times? Simple questions like that can really open up a deeper conversation.
What about patients who are hesitant to talk about spirituality? Or the ones who aren't even really aware of their own spiritual needs?
Then we got to rely on observation, looking for those cues, both verbal and nonverbal. Are they expressing hopelessness? Have they stopped doing their usual spiritual practices? Are there changes in their sleep or their appetite?
Looking for those subtle signs.
Exactly. And just being present, listening carefully, letting our intuition guide us. Sometimes just offering a compassionate presence can make all the difference in the world.
This has been incredibly insightful. We've laid this, solid foundation about spirituality and how it all connects to healthcare. Now, I'm really curious to dive into some real-life nursing scenarios.
Me too.
Yeah.
Let's put those critical thinking caps on and explore some of those case studies. All right, let's dive into those case studies. It's one thing to talk about concepts, but seeing how they play out in real nursing situations really brings it all home.
So, first scenario. Imagine you're a nursing student on clinical rotation, busy hospital, and you're assigned a patient, a 16-year-old girl who seems, withdrawn, anxious.
Okay, yeah, already I'm thinking, what's going on with her? Adolescence is tough anyway. So much change and development, and then being in the hospital on top of that.
And then, during one of your interactions, she tells you that her younger brother is really sick, his condition is getting worse, and she's terrified because her family are Christian Scientists, so they're only relying on prayer for healing.
Wow, that's heavy for a young person to carry, especially when you've got that potential conflict, between what her family believes and what medicine can offer. She must feel so torn.
She does. She believes in prayer, but she's also scared about what could happen if her brother doesn't get medical treatment. And she's a nursing student, so she's caught in the middle.
This is such a classic example of those ethical dilemmas that come up in nursing when you're dealing with spirituality and healthcare decisions. What are her responsibilities to her patient, to the family? How does she balance her own beliefs with what she's supposed to do as a nurse?
So much to think about, especially when you're just starting out in nursing.
It is. In this situation, I think the first thing she needs to do is gather information. What's wrong with the brother, specifically? What are the risks and benefits of different treatments?
She also needs to understand the legal and ethical guidelines, right? About parental rights, a child's right to care. The stakes are high here.
Absolutely. Talking to her instructor, a mentor, someone she trusts, that's crucial here. They can help her figure out how to approach the family, how to talk about their concerns, and how to advocate for the child while still respecting their religious beliefs.
Finding that balance.
Exactly. And communication is key. She needs to approach the patient and the family with compassion, with empathy, acknowledging their fear, validating their concerns.
Not trying to change their minds or push her own views on them.
Right, just listening, trying to understand. She could gently ask them about how they understand the illness, why they've chosen prayer.
Maybe see if there are any situations where they might consider conventional treatment.
Exactly. It's all about having that open, honest dialogue, but respecting their right to make choices for their family.
But what if, even after doing all that, she still feels like the boy is in danger?
That's where things get really tough. If she believes his life is at risk, she might have to think about involving other professionals, social services, maybe even child protective services.
That's a hard call, but the child's safety has to come first.
It's a difficult decision, but it shows how much responsibility nurses have. We're not just there to give meds or check vital signs. We're advocates, and that sometimes means making really tough choices to keep our patients safe.
This case really shows why critical thinking is so important in nursing. Ethical decision-making. Understanding the rules we have to follow.
It does. And it reminds us there are no easy answers. Every patient is different, every situation is unique, and we have to be ready to deal with those complexities with sensitivity and, a commitment to doing the right thing, even when it's hard.
Okay, let's switch gears a bit. Look at another scenario. This time, we're in a long-term care facility. You're the nurse, and one of your residents, Mr. Cohen, is an Orthodox Jew. He's had a stroke, needs a lot of help.
Okay, so right away, I'm thinking about the spiritual side of things. A stroke can be so debilitating. Loss of control, dependence on others. For someone whose faith has always been a source of strength, their identity, that can be really hard to deal with.
And to complicate things, the facility is short-staffed. The aides mean well, but they're not always aware of Mr. Cohen's religious and cultural needs.
I can see where this is going. Even little things, if you don't get them right, can have a big impact on someone's spirit, especially when they're already vulnerable.
And that's what happens. Sometimes he gets served food that's not kosher, or they forget to help him with his morning prayers, which are so important to him. And over time, he starts withdrawing, refusing to eat. expressing anger and hopelessness.
That makes sense. Those oversights, even if they're accidental, they feel like a betrayal to him. Like his faith, his identity aren't being respected. He might feel abandoned, even question God.
It shows that spiritual care isn't about grand gestures. It's about those little details that allow a person to live according to their faith, to feel whole.
I agree. And it shows why education is so important for everyone in healthcare. In this case, the nurse needs to speak up for Mr. Cohen, make sure the staff understands his religious practices.
So how would you handle that as the nurse?
I'd start by talking to Mr. Cohen, tell him I'm concerned, ask him to share what's been happening, really listen, validate his feelings, let him know that his spiritual needs are important.
And then take action, address those needs.
Exactly. Maybe educate the staff about Orthodox Jewish customs, the dietary laws, make checklists, visual reminders so his needs are met consistently, work with his family on a care plan that honors his practices.
And what about getting a rabbi involved, someone from his community?
That's a great idea. Connecting him with a spiritual advisor can be huge. It links him back to his community, gives him support, and the advisor can help the staff understand those nuances of his faith.
This case really shows how important it is to recognize spiritual distress. As we said before, it can show up in different ways: withdrawal, anger, changes in appetite, even physical symptoms.
It reminds us that nursing isn't just about the physical. We have to be tuned into the emotional and spiritual side, too. All these things are connected.
And sometimes the most powerful thing we can do is address that spiritual root of their suffering.
You got it. Seeing the whole person, not just the disease. And when we honor those spiritual needs, we give them a chance to find strength, meaning even healing, no matter what they're going through.
These case studies have been so eye-opening. They really show how complex this whole thing is, spirituality and nursing, and how important it is to see each patient as an individual.
They do, and they remind us that as nurses, we're going to face situations with no easy answers. But if we stick to our ethics, show compassion, and approach each patient with an open heart, a willingness to learn, we can handle these challenges and provide care that really makes a difference.
I feel like we could talk for hours about these cases, uncover all sorts of insights.
I know, right? But we've covered a lot today. Maybe it's time to sum things up for our listeners, leave them with something to think about.
It sounds like a plan. Let's do that after a quick break.
We're back, and wow, we've really gone deep on spirituality and nursing. It's clear this isn't just some extra thing, some nice to have.
It's like woven into the core of what it means to be a nurse. Those case studies were powerful. The young woman and her family, Mr. Cohen and his needs, even the nurses trying to figure out the right thing to do.
A lot to think about. So before we wrap up, I want to pull out some key takeaways, maybe give our listeners something to reflect on. What are you hoping they'll walk away with from this deep dive?
Well, first off, I hope they see how diverse spirituality really is.
Yeah.
It's not just about religion. It's about meaning, purpose, connection, all those things that become even more important when you're dealing with illness or hardship.
Need to make sense of things, especially when life gets hard.
Right. And as nurses, we can't just assume we know what that looks like for each patient. Those questions we talked about, paying attention to those little cues, that's how we really get to know where they're coming from. And that spirituality can be a huge source of strength, but also a source of conflict or distress.
Exactly. Like those life-affirming versus life-denying influences. We need to know how to support patients when their spirituality helps them cope, but also when it might get in the way of their care.
That balance, right. Respecting their choices, but also looking out for their well-being. And something I kept thinking about is that we as nurses, we're not supposed to be spiritual experts fixing everything.
No way. We're more like facilitators, guides. We connect them to resources, whether that's a chaplain, their own spiritual leader, or even just a quiet space to think.
And we support their coping mechanisms, whatever those may be. Prayer, meditation, being in nature, whatever helps them find that strength.
And I think most importantly, we show them compassion. We don't have all the answers, but we can be there for them as human beings, walk with them through those tough times.
That human connection, that might be the most powerful thing we can offer. We talked a lot about patients, but I think it's just as important for nurses, especially new nurses, to think about their own spirituality.
Oh, absolutely. Nursing is a tough job. We see suffering, loss, people facing their own mortality. It takes a toll.
So how do we as nurses take care of our own spirit so we can be there for our patients?
It's different for everyone, right? Some people find it in their religion, others in nature, being creative, meditation, or just being with loved ones.
Finding what nourishes us, what helps us make sense of it all.
And remembering, It's not selfish to take care of ourselves. It's essential. If we're burned out, we can't give our patients the care they deserve.
This deep dive has been incredible. We've covered so much: what spirituality is, how it affects healthcare, the ethical challenges, even self-care for nurses. I hope this conversation has sparked your curiosity, helped you see just how important spirituality is for patients and nurses alike.
Me too. As you go forward in nursing, remember that every patient is a chance to connect with the human spirit. Embrace that with compassion, openness, a willingness to learn. You might surprise yourself with what you discover about your patients and about yourself.
Thanks for joining us for this deep dive. We hope it's given you something to think about as you start your own journey in nursing. Keep learning, keep exploring, and keep caring.